For available this de-addiction centers in the hospital, and how to see whether these patients who need treatment, how we can actually start this center. Dr. Saxena had said in this morning something that we need to have more and more such centers.
You mean development of de-addiction centers in the hospitals? Is it?
Yeah.
See, you need to have every hospital has a psychiatry department. So the psychiatry department with psychologists is a very important aspect in treating every disease you have. And in the city, this drug abuse is a massive problem. So the psychiatrist along with psychology, I believe, has to work in tandem. And then we work out with every patient their psychology. I being a surgeon myself, hospital owner, I understand the importance of how you wean off a patient from a surgery and then develop it into a normal patient. Similarly, these hospitals, you need to work with a psychiatrist and a psychology, and you develop behavioral stages in the patient, and then you work at least a de-addiction center. I believe in a city you need to have at least 10 de-addiction good centers in the city. Like in my city in Guwahati, we are blessed with around 10 good de-addiction centers, and almost every de-addiction center we promote a psychologist to be visiting regularly. And audience is there. We have been working randomly in the Northeast developing these de-addiction centers by the Golden Triangle, that is Thailand, Burma and Laos, where you get the maximum number is opioid and cannabis cultivation. And two states particularly I would like to mention, this Nagaland and Manipur, where we are suffering the most. And then the places like Assam, Tripura, Arunachal Pradesh, where the drug peddlers can just move around. So this is where the government has to step in. We are lucky in Assam that our chief minister is working very nice. I worked 100 days in a program of de-addiction in Northeast and Assam, and we got fantastic results. We have even done some demo theaters on the roadside. We managed to put some hoardings in every car we passed through. The message was loud and clear.
It is there as shown, and basically it is all as shown here in this slide. Second one is that how does our safety entry system work? The safety entry station is different from a regular description of how the checkup is done, or a standard process which you call it. So in a standard process you go through a nurse or a nursing assistant. It takes 18 to 23 minutes. Here it takes less than 20 seconds. And as far as the result is concerned, it takes about from 1 minute to maybe 24 hours to get the results, like a regular, when you're doing a regular checkup of your vitals. And out here it is less than 3 seconds. So, and this is non-invasive. Ours is non-invasive, and the regular standard procedure is invasive. And you have trained manpower. We don't require, it's all automated. As far as the data is concerned, data is to be collected by the standard procedure, but whereas in our safe entry station, it is automatically done. Predicament detection for prevention, the drug or substance abuse, and the outlook. Basically, it helps early detection of substance or drug abuse. So that's between for the teens and the young, like what we did, what I said about detect and protect. And so is the case with like you provide required counseling, and they take it forward from there and manage the patient or the person concerned. So what all vitals are captured here? You capture the heart rate, and you capture all the parameters which are available. Other than that, over and above that, you have alcohol and cannabis impairment, and oxygen saturation. You have the BMI, BMR, health, height, weight, etc., including the blood pressure. It also talks about, projects the fatigue in the body, which leads to depression and stress. All these tests are done within 16 seconds. What makes it different is that it is basically contactless, it is safe, it does not have any touch, non-invasive, and does rapid screening. It is safe and secure. What is the standard procedure? First you come and register, then you have a QR, FR. FR is optional for the employee, with facial recognition. It is automatic and the activity of the medical counseling is required. So this is how the whole procedure takes place, and the benefits are mentioned here. Mostly it is because it's non-invasive and it is contactless, and it gives faster, the results are very fast. And global presence, it's an American company, so it's present in the US, Canada, Mexico, South Africa, and now presently in India. And this is one clip which I would like to show you, so it shows how a person is. Dave, you click it. It will be presently at the skill development center. You will see
and I am the secretary at Skill Development Center, BTC. We have 6 skills in which we train. Get skill, get a job. So we are just asking for few months of 3 months of training and time from the student. Nothing is charged from the student, even the books and the uniform is paid by the Skill Development Center. We are also very concerned about the health of our children. So we want they should not be.
Safe entry station. So he's gone through it, all his vital parameters out here, and this basically works on thermal imaging and artificial intelligence. The basic works on the data which is collected, and with that we can even detect the infectious diseases. Other than what I have mentioned about substance and alcohol and cannabis.
That's wonderful. I think this is a wonderful thing to be introduced in India. I think that's going to really work in the Northeast and the Punjab area. That's very. So we quickly, if there are some questions from the participants, just 2 questions we will take.
Judith, please ask your question. Please stand and then ask.
Hello, my name is Judith. I'm from Congo. My question is, how do I know if someone is addicted to drugs? And I want also to know if the symptoms are the same for all the addicted.
Is having addiction. So the first thing you will see is that there is a lot of change in the person's behavior. Okay. The second thing that you will realize is that there is a lot of drug seeking behavior. You know, he will try to be alone, he will seclude himself. Third thing, what is going to happen is he'll start becoming more irritable, angry. He might start demanding more money, you know. You might see him in an intoxicated state, and his academic performance or his school or educational performance will start dropping down. All right. So that is the time, you know, with the change in all these behaviors you can see. And there are different symptoms for different disorders. You know, like with alcohol, the effect can stay for a day or 2, but with cannabis over a long period, like Sir said, he can develop schizophrenia, bipolar disorders or other diseases. And today we are talking about addiction. Let me tell you, 50 to 80% people have mental health disorders who are suffering from addiction. So if you don't treat them along with addiction, it is not going to work out. So symptoms are different.
Good afternoon, my name is Hawa Mohammed. I'm from Nigeria. So my question goes like this. It said drugs is this, like, it's a trial. But there's something I've noticed in Nigeria, like
Keep your mic closed.
From 2013 to 2015 in Nigeria, women dabbled into drugs because they want to suppress anxiety and depression. Will we call that a trial or suppression of a certain feeling by taking drugs? It's more of like a psychological problem, taking drugs to suppress whatever feeling you're having. For example, I'm being depressed and I have a lot of things going through my mind. So they feel taking some certain substance, for example, codeine, just to suppress whatever they are feeling, to enable them to sleep or something, just to take their mind off whatever they're feeling.
Very interesting question, and I think this is very important question what she has asked. We have found in research and in our studies, scientific studies, all kinds of addiction starts from anxiety. It starts from childhood, from anxiety. Anxiety, when it is especially in the, I could have shown, but now I'll explain it because time is very less. So I'll explain this concept. This is what, and this is what way you can prevent your child. Youth can be prevented from addiction disorders or any kind of addiction. The first thing in the family when a child is born, his anxiety is his father. Any child has to have a very good relationship. What we have found is with father figure. If father and child's communication is bad, we have found that 90% of the addicts in the jails, their trial studies have shown there is no father relationship. So we have to see in the family, I'm going to very specific points. And then the trust is not developed. If family has no trust in each other, husband, wife and child, there is a strong chance that child will go towards addiction. Trust and trust.
So that very important aspect, confidence, trust and communication.
Child grows, as the child grows into teenage, again there is a big suppression of emotions due to his sexual instinct, due to the sexual pleasures and things which are not exposed, which he can't express. Again there is a teenager conflict, and that teenager conflict is between 12 to 13 years to 19 years. If that is taken care again, which is generally children go to friends, but if again I tell you, request you, that if you want to save your child or a youth from becoming addict, father should become friend with his child. Mother is always there. Father should become the friend. Papa should become the friend of the child. First friend of the child is father. अगर father नहीं रहता है तो बच्चे का इमोशन एकदम डिस्टर्ब हो जाता है. तो हम लोग कहते हैं फादर का चाइल्ड का रिलेशनशिप ये सबसे बड़ा है टीनेज में, जब दोनों का फ्रेंडशिप होना चाहिए.
They are lending themselves into another problem. It is not a solution. It is a second problem that they are getting into, which is addiction.
Wonderful. So actually what Dr. Kranti had said in the very beginning, yoga, meditation actually takes care of a lot of things. That is very important. Yeah, very quick answer. Quick.
Control their anxieties and emotional suppressions in dealing with those outside. Now, being you being a female, you need to understand, in our India, like in Hindu psychology, we believe females, mothers are like the art. The mothers have to absorb everything. So, today morning also, there was some sort of similarity of the situation in my home also. Since I am not in my home, my child somehow had a small sort of anxiety problem with the mother. Now, as my friend has told, since I am not there, I had to, being a father, had to counsel the child myself.